Welcome to the Los Angeles County Department of Mental Health's monthly magazine, Meeting of the Minds. I'm Karen Zarcedias. In this month's Mental Health Minute, how you feel at work is a good reflection of how you feel on the inside. That's according to the American Psychological Association. The association conducted a survey and found that employees who felt valued are more likely to be healthier, physically and mentally. And happier workers tend to be more satisfied and motivated in the office compared to those who do not feel valued by their employers. The American Psychological Association defined a happy workplace as one where employees felt involved, safe, and recognized for their contributions. They also cited employee growth and development, as well as a positive work-life balance as additional factors. In other news, there's a new definition for the term recovery. The Substance Abuse and Mental Health Services Administration, or SAMHSA, released its updated meaning of the working term recovery for policymakers, providers, and clients. The new definition of recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. The definition is meant to promote more awareness and appreciation for the importance of recovery. SAMHSA's Recovery Support Strategic Initiative also included 4 major dimensions that support a life in recovery, and those are health, home, purpose, and community. It took several meetings with stakeholders and public feedback to develop the working definition and principles of recovery. To find out more about the new definition of recovery and the guiding principles of it, visit the SAMHSA website at samhsa.gov. Hope, Wellness, and Recovery is our department's motto, and with more about what DMH is up to, here's a message from our director, Dr. Marvin Southard.
Since Karen mentioned the definition of recovery within the world of mental health care, I thought I would say a few words about the role that hope plays in supporting recovery. The Los Angeles County Department of Mental Health has as its vision supporting the hope, wellness, and recovery of our clients. We added hope to the vision statement at the request of our clients who told us that one of the things that they needed most from the treatment process was the hope that a full and meaningful life was possible for them. Many of our clients talked about their lives in the way that Maya Angelou put so eloquently. "Never let go of hope," she said. "One day you will see that it has all finally come together, and you will ask yourself, how did I ever get through all of that?" Another thing that our clients taught us was that for many of them, their personal spirituality plays a key role in maintaining hope in their lives in the face of very difficult circumstances. And they asked that the spiritual dimension of their experience be incorporated as a resource in their recovery process. So since that time, DMH has been creating partnerships with faith communities of all kinds to build greater support for our clients in their own neighborhoods. We are also learning how to include a person's spirituality appropriately in treatment. So we thank our clients for the gift they have given us about the knowledge of the importance of hope and spirituality.
Thank you, Dr. Southard. We like to share stories and tips on wellness and recovery on this show. With more about this in our Walk the Talk segment, here's Kathleen Pache.
Thanks, Karen. My guest today is Gary Gugee. Gary Gugee's journey of recovery from anxiety and depression really started when he became a client at South Bay Mental Health. After 4 months of trying different medications, his anxiety lessened and his mood improved. He wanted to learn everything he could about staying well and became a volunteer at South Bay Mental Health for 2 years. He was introduced to the Procovery tool and began facilitating groups and developed his own. Gary took a weekly group of 3 people and turned it into 30. He was hired as a peer advocate and was later promoted to community worker. In 2007, he won the DMH Volunteer of the Year Award. Gary has made a difference in the lives of many staff and clients. Welcome, Gary, to Walk the Talk.
Thank you.
Let's talk about your recovery. How do you maintain your own recovery?
Well, it hasn't been that difficult for me to maintain my recovery. You know, my recovery has moved from a state of recovery into a state of wellness, and it had a lot to do with the job that I have. It's very therapeutic for me.
Mm-hmm.
And
as an advocate?
As an advocate,
helping others?
Yeah, helping others is very therapeutic. Being able to understand more about what was ailing me, you know, it helped me to focus on being well instead of having a plan to be sick.
Well, how do you handle when symptoms come up?
The first symptom I get, if something, because I suffer with generalized anxiety and major depression. And it's not a struggle for me anymore. Usually the symptom that comes up to me is if I get real quiet. If I get quiet, you know, before the illness would force me into isolation or detaching from others, but that doesn't happen anymore. Usually when I get quiet now, I use it for something that needs to be quiet. Like I use it to do paperwork because that takes being quiet. And I shift my focus into music. I like to listen to music, and that takes being quiet. And I also exercise.
I know that you're involved with the Pro-Covery Circle, and that has really helped you too, and many others. How does that work?
It brings a smile to my face to talk about Pro-Covery because, you know, the difference in Pro-Covery is always moving forward. You know, it implies that you're moving forward, and you know, through the process of learning about Pro-Covery, it catapulted me into a different level of wellness.
And you can start where you're at. No matter where you're at, you can start wherever you are.
Right. You don't have to have a certain diagnosis. You don't have to have a certain ability to pay attention. You just need to be in the circle because the circle has a healing power of its own. And what it does, we address topics like dissolving stigma, managing medications, self-care, making intentional choices instead of reactive choices. It addresses a whole part of us, not just illness, but everyday living. Mm-hmm. And that's why it became so powerful to me. And what happened while I was seeking the help at South Bay, this was something I really needed. Mm-hmm. It answered a lot of questions for me pertaining to how to change my lifestyle and be productive and accept my illness as it was.
And now you're teaching others about
Absolutely. And I think that's what makes my job very wonderful too, because I get the chance to participate in people's lives every day in a positive way.
You're so inspirational because you are walking the talk. You've been there, you've done that, and now you're getting promoted all over the place. And you've grown your group from 3 to 30 people, which is amazing. And I know you call them to make sure they show up every time.
Absolutely. I call every week, and a lot of people I work with say, how you do that, why you do that? I say, because people need to know that someone really cares about them, and not only that someone cares about them, but also that we need to be inspired. You know, I find that inspiration works a lot better than motivating, because with inspiration, hope is attached to it. And we all believe in a process of hope.
Mm-hmm. How does being an advocate help you?
What it does for me is it gives me a sense of fulfillment and purpose. And every day I feel like I'm going to be able to serve someone and enrich their lives just by an encounter with them.
Mm-hmm. Thank you so much for coming today.
Thank you, Kathleen. And I want to thank the department, because the Department of Mental Health in Los Angeles County is awesome. Because I would never have gotten nowhere near as well as my whole life is full now.
Thank you so much.
Thank you.
Back to Karen.
Thank you, Kathleen. And that's the show for this month's edition of Meeting of the Minds. To learn more about the Department of Mental Health and for more information about DMH's programs and resources, you can always visit the website anytime at dmh.lacounty.gov. You can also follow us on our Facebook page and watch our Profiles of Hope videos and PSAs on YouTube. Just search for the Los Angeles County Department of Mental Health, or LAC-DMH. And if you or someone you know is in need of help, you can call our 24/7 access line at 1-800-854-7771. That's 1-800-854-7771. Thank you for watching. We'll see you again soon.